Hello and welcome to the recovery training on the new early phase assessment intervention of dimethyl fumarate. This is the current design of the recovery trial with eligible patients hospitalised with proven or suspected COVID-19 entering into any number of the suitable randomisations shown on this page. Dimethyl fumarate enters the trial as part of the Part A randomisation in the top left, meaning if sites are participating in this assessment, participants may be randomised to one of colchicine plus usual care, dimethyl fumarate plus usual care, or usual care alone. This early phase assessment will be limited to adults of 18 years or older. The treatment regime of dimethyl fumarate used will be an oral dose of 120 mg every 12 hours for 4 doses, followed by 240 mg every 12 hours for a further 8 days. That is, continuing to a total of 10 days treatment or until discharge, if sooner. The contraindications of dimethyl fumarate include pregnancy and breastfeeding. A negative pregnancy test result is required in women entering the trial of childbearing potential. It is also contraindicated in patients with a known hypersensitivity to excipients in any oral therapy. Side effects of dimethyl fumarate include diarrhea and flushing, which are commonly reported but usually mild. The incidence of these side effects and the need for discontinuation of treatment will be recorded within the trial. The dose can be reduced for these symptoms if required, initially from 240 mg twice daily to 120 mg twice daily, and further to 120 mg once daily, or stopping completely if required. This early phase assessment has been set up after a recommendation from the UK COVID-19 Therapeutic Advisory Panel. There are promising theoretical and in vitro data to suggest dimethyl fumarate may be effective against COVID-19, but additional information is required before considering a large-scale assessment of impact on mortality. For this early phase assessment, we have estimated that we will need approximately 400 participants, and then we'll be able to review results in order to make a decision as to whether to include dimethyl fumarate in the main trial. In terms of study procedures, many things will remain exactly the same as for the main trial, including eligibility criteria, consent process and patient information sheet, the randomization website, and safety reporting in the form of suspected serious adverse drug reactions. As mentioned, dimethyl fumarate will be included in the Part A randomization for appropriate sites. For further details of any of these aspects, please refer to the study protocol or other training modules on this website. The main difference in this early phase assessment will be the recording of specific new outcome measures and a new online follow-up form in order to document this information. The primary outcome of this assessment is something called the SF94 ratio. This is a non-invasive bedside measure of patient oxygenation. It is similar to the PaO2 to FiO2 ratio, which is the partial pressure of oxygen in arterial blood to the fraction of inspired oxygen the patient is receiving. But our assessment will not require arterial blood gases to be taken. Secondary outcome measures in the study will include an Ordinal scale clinical progression score, laboratory results in the form of CRP, creatinine, and alanine or aspartate transaminase results. All of these tests are routinely measured in hospitalised patients. We will also collect data on the incidence of common adverse events and treatment adherence. To clarify exactly which participants need these outcome measures to be completed, they need recording for all patients who were randomised within the dimethyl fumarate comparison and were allocated either dimethyl fumarate or usual care alone. That is, we must measure these outcomes in both patients who received the intervention of dimethyl fumarate and in those who are their control group. If a patient was eligible for colchicine and dimethyl fumarate and they were allocated colchicine, these extra outcome measures are not required. The primary outcome measure, the SF94 ratio, is a measure of the patient's oxygenation. It is defined as the ratio of oxygen saturations to the percentage of inspired oxygen when the patient's oxygen saturations are less than 94%. It improves accuracy compared with measuring the ratio at SATs of greater than or equal to 94% because of the ability of hemoglobin to become saturated at higher oxygen levels. This means the oxygen saturation measure cannot rise much further regardless of the amount of oxygen received when it is in this zone. This measure will be performed as a bedside test by a member of the research team, and we will estimate it will take between 10 and 30 minutes per patient, depending on patient and environmental factors. It will be measured directly before randomization and on study days 3, 5, and 10. This is an overview flow diagram of the measurement procedure for the SF94 ratio. At first glance, it may look complicated compared with the rest of the trial, but in reality, it includes just 3 steps before measuring data at the patient's bedside. Hopefully, after reviewing the training materials and carrying the measurement out a few times, the procedure will become familiar and feel reasonably simple. There is a standard operating procedure document available on the website that describes the measurement procedure in detail, but we will also go over the main steps here. First, the patient's oxygen delivery method should be switched to one that measures the fraction of inspired oxygen accurately. This means one where we know what percentage oxygen the patient is receiving. Acceptable modes for this include no oxygen, commonly called room air, a Venturi mask, any form of CPAP, non-invasive ventilation, high-flow nasal oxygen, or invasive mechanical ventilation. Modes which are not accurate for this are nasal prongs or simple face mask oxygen, so patients receiving these should be switched to an acceptable alternative. Comprehensive details of the suggested way to do this are included in the standard operating procedure document. Secondly, the participant should be resting in bed with the head of the bed at an approximately 30-degree angle for at least 5 minutes to ensure a steady state in measurements. They should also be politely asked not to talk during the assessment. Third, the participant's oxygen saturations should be measured using a pulse oximeter. If they are greater than or equal to 94%, the oxygen therapy should be carefully lowered at 5-minute intervals until the saturations are measured at less than 94% or the patient is on room air. Again, full details of how to do this are in the standard operating procedure. This procedure remains safe for the patient. Short periods of low oxygen levels, for example, oxygen saturations of 80%, are not considered harmful. Please do monitor the patient for any signs of distress throughout and increase the oxygen back to the previous setting if distress does occur. Once the patient has oxygen saturations of less than 94% or they are on room air, please record the oxygen saturations, the percentage oxygen being delivered, the oxygen delivery mode, and the participant's respiratory rate, and then switch the patient back to their original oxygen therapy. In order for the patient to be randomized to the dimethyl fumarate comparison, the SF94 ratio will need to be performed and the required data shown here input into the randomization form. Here you can see the requirement for oxygen delivery mode, the inspired oxygen concentration percentage, the peripheral oxygen saturations, and the respiratory rate. Inputting this data will then allow randomization within the dimethyl fumarate comparison. On study days 3, 5 and 10, the same measurements will be undertaken and submitted via the online follow-up form on Open Clinica, that is the same portal where all other follow-up data is input within recovery. Here you can see a screenshot of the layout of the form, showing the measures required and where to input them. The Ordinal scale score is a clinical progression score ranging from 1 to 7, endorsed by the World Health Organization, which gives an overview of the patient's current clinical status. The relevant score and descriptor should be recorded daily from study day 2 until 10 or discharge, at the same time each day, if at all possible. A score of 1 indicates the patient has been discharged from hospital alive, and once this is submitted, no further ordinal scale scores will need to be recorded for that participant. A score of 2 indicates the participant is in hospital but not requiring oxygen and not requiring medical care. This covers the category of patients who may remain in hospital for social care reasons, even though they are medically stable for discharge, or for patients who are staying in hospital purely for infection control precautions. A score of 3 means the patient is in hospital, not requiring oxygen, but requiring medical care. A score of 4 means they are in hospital and requiring oxygen by a face mask or nasal prongs. A score of 5 means they are requiring oxygen via high-flow nasal oxygen, CPAP or non-invasive ventilation. A score of 6 means they are requiring invasive mechanical ventilation, and a score of 7 means the patient has sadly died. Laboratory results are required on study days 3, 5 and 10 for CRP, creatinine and ALT or AST, depending on which one is performed locally. These blood tests will often be done as part of routine clinical care, and if they are, these results are entirely appropriate to be used for the study. If the blood tests have not already been performed, please take a blood sample for measurement of CRP, creatinine, and ALT or AST for the participant, and have it processed in your local laboratory for routine analysis. The results are submitted onto the follow-up form as shown here. Please also record the upper limit of normal for your ALT or AST result here in the bottom right, which will be published by your local laboratory. Dimethyl fumarate adverse events and adherence will be measured on study days 3, 5 and 10. Please record the presence of new diarrhea or flushing on the follow-up form by marking none, some or severe, as shown here. Participants should rate the severity, or if they are unable to do so, please ask a member of the clinical team. The adherence to dimethyl fumarate will also be recorded. Please mark the dose the patient received in the preceding 24 hours and list the reason for treatment discontinuation, if applicable. At day 10 or discharge, the total number of days of dimethyl fumarate the patient received will be requested. This summary table shows in the square brackets when each of the outcome measures for the early phase assessment should be recorded, with study day 1 being the day of randomization. This will require a bedside visit of perhaps 20 to 30 minutes to the patient on study days 3, 5 and 10, although many items, such as the laboratory results and ordinal scale score, are likely to be able to be recorded from the standard medical notes for the patient. Thank you very much for listening to this training video.